All right, welcome everybody. We are about to start our live today. I'm just getting everything set here. We'll give it a minute for everybody to join on. But let's go. Here we go. Okay. Reset there. All right. All right. Hope everyone's had a wonderful week. All right, here we go. Okay, so thanks for joining. My name is Dr. Tsai. I'm a board certified plastic surgeon in Los Angeles. How do I do that? I hope everyone's doing well. We'll give it a minute for everybody to join on. Like I said, my name is Dr. Tsai. I'm a board certified plastic surgeon in Los Angeles. I am in Miami once a month as well. Right now I'm on TikTok, Instagram, and YouTube. What is the price range for revision rhinoplasty? Usually starting around 18,000 and up. 18,000 and up. Again, depending on the situation. If it's a little bit smaller, it can be less. Sometimes we just do a tip plasty. That's obviously going to be less. But if you have to do the bridge and some of these other things, then that's probably going to be around 18,000 or so. But could be a little bit more, could be a little bit less. But that's kind of the average for a revision. Primary first timers, we're doing it for 15,000. Okay. Let me get jumping on Instagram here. Great. All right, so the link tree in my profile is a very good resource. We spend a lot of time, curating content on there, before and after page, our regular Instagram, TikTok, YouTube, and Snapchat for doing surgery. So we do have all those in for you guys to kind of look out and check into. So that's a very good resource while we're waiting for everybody kind of to join on. How much is a mole removal by the nose? Are we shaving it? Or are we pulling it out? Are we stitching it and sewing it up? It really depends. I would say anywhere from 1,000 to 2,000, something like that. Again, depending on if it's a shave or if we're kind of pulling it out and putting stitches on it or things like that. All right, well, welcome everybody from Instagram. Thanks for joining. I'm Dr. Tsai. I do this every Wednesday from 1 to 2 o'clock Pacific Standard Time. I'm on Instagram, TikTok, and YouTube. This is just a Q&A session for anybody who's interested in the aesthetics, health, regenerative medicine, non-invasive kind of beauty industry. You guys can ask questions here. You don't have to go to Google or ask ChatGPT. You can ask me about my experience, how I got here, and kind of how I would assess things. So this is just a Q&A again for everybody who's interested. Again, now I'm on YouTube, we're live on YouTube, Instagram, and TikTok here. So we're gonna try to hit things, hit them all, hit all the other platforms. Do you work out every day? About 5 or 6 days a week. Yes, 5 or 6 days a week I do work out. Let's see. What thoughts on Motiva implants? I like them. I've done more of those recently. I actually just got off a phone call from a patient I'm going to do next Friday, and she wants to switch over to Motiva. I did one last week. I did one about a month ago. So we're doing, a handful every month at the moment. I do like them though. They seem to be working very, very well. I know I have at least one, if not two, in December as well for Motiva. So far I'm liking them. Do you work under IV sedation? Generally not. I usually do either local, where you're fully asleep and we just numb you up, or fully asleep. Sorry, fully awake or fully asleep. The IV sedation, it really depends on the situation, but I generally don't. Hey, Jacqueline, thanks for joining. What kind of doctor are you? I'm a board certified plastic surgeon and I do cosmetic surgery, face, breast, and body. Mostly noses and breasts are what I'm known for. I really want my lower belef. Great. I actually did one under local awake on a good friend of mine actually about a month ago. And so sometimes you can do them awake, sometimes you can do them asleep depending on the situation. But Jacqueline, if you're interested, hit that link tree in my profile, schedule a consultation. The link tree has a link to my scheduling page, so you can schedule directly into my schedule, and we can have a chat, and we can do a virtual consultation like this if you're not in LA, or you're more than welcome to come in to the office and we can talk. Do you do labiaplasties? Yes, I do. Yes, I do. I actually have a couple photos. We can't post them, unfortunately, but if you come to the office, more than happy to show you. But yes, I do. I would like a facelift. Well, Mavel, you came to the right place. Again, if you guys want to book a consult with me, click that link tree in my profile and schedule a consult with me, and I would love to kind of chat with you about that. Do you think lip lifts look naturally as you age? Yes, I mean, I think so because the thing is, as you age, actually, in fact, it probably is better as you age because as we age, the upper lip does tend to lengthen. It was funny, about a month ago or so, I had a slew of lip lift consults that came in, and they were older patients. And their complaint was, my lip looks very, very long. Okay, so as you age, that lip does look very long. And so if you had a lip lift, if anything, it just lengthens it over time. It's not going to look abnormal. If anything, it'll continue to stretch out. You might need another one if you like how that looks. So no, I don't think it's going to age weird. I think it's going to age normally and gracefully. All right, a lot of questions coming in, so I'll go a little quicker here. Hello, hi, Nakuza Zaj, thanks for joining. So I have to ask, does it hurt when you fell from the vending machine? Because you, that's a nice, nice pickup line there, J Beeb 7. Okay. I am a triple D and want to lift and wondering if I should do a lift in like silicone. I'm a triple D and want to lift and wondering if I should do it. I mean, if you're already a triple D, I'm like, how much bigger do you want to be? I mean, I think just a lift is good enough. I don't think you need an implant or more volume. I mean, triple D is pretty big. We can have a call, again, Jacqueline, and click that link tree in my profile. Let's have a chat and discuss kind of what you want so I can kind of take a look at your breast and kind of see what the best, results are for you for your goals. But with a triple D, I don't think you need an implant. I have Carl Madden bulbous nose tip. Is there hope? I don't know who Carl Madden, but yeah, bulbous nose tip. We can definitely shrink that down for you. Absolutely. There's definitely hope for sure. Cheek and mid facelift, pros and cons. I don't really think there's many cons to it. I mean, obviously, when we do plastic surgery, the point is to be better and look, improve our appearance. So I think it's a great procedure to lift the mid face and the cheeks. I think it's great. The cons are, I guess, maybe potentially some scarring, but if you're a female that wears your hair kind of, around your ear, you're never going to really see the scars. Obviously, there's some healing time and you're going to be out of commission for, a couple of weeks, a month at the most. But other than that, I think there's definitely way more more pros. So your face looks plastic. Well, thank you, I guess. I haven't had anything done, just Botox, so that's me. If I had paniculectomy to remove 12 pounds of excess skin, it's been over 2 years, I still don't. I lost 125 pounds naturally lifting weights, and I just feel like my skin is loose. I mean, if you lost 125 pounds, yes, you're definitely going to have a lot of loose skin. You might need your breast lifted, your tummy lifted, your back lifted, a body lift, thigh lift,